The University of Tennessee Medical Center is our region's only academic medical center. Our mission is to serve through healing, education, and discovery. Our goal is to share the knowledge of our physicians and staff in these health education videos as you make healthcare decisions for yourself and your family.
Well, in 2010, we, with the collaboration with the UT Medical Center, decided to try to improve our total joint delivery program. And with this in mind, we looked at what other programs were doing and decided to establish a total joint program at the University of Tennessee. We looked at what other programs were doing and adopted several features, including a dedicated unit in which the total joint patients are set apart from the regular hospital population. And so each patient that's coming into the total joint unit is there to have a knee replacement or a hip replacement or a shoulder replacement. They're not mixed in with the general population. As such, we were able to dedicate physical therapy and nursing just to that unit. Those personnel are specifically orthopedically trained to deal with the problems that are going to come up with total joint patients specifically. One feature that was utilized in a lot of programs was a wellness-based approach to dealing with total joint patients. Patients that are needing hip or knee replacement are not sick. They're healthy, active patients. They're just seeking a procedure to deal with chronic pain so they can get back to their regular activities and a more active lifestyle. With this in mind, there were several features adopted. One was to try to get the patients back into their regular street clothing as quickly as possible. Early and accelerated physical therapy, which meant getting patients up the day of surgery, doing therapy 2 or 3 times a day, including group therapy. Getting out IV lines and Foley catheters as quickly as possible to free them up so that they could engage in the therapy more completely. And also we adopted the idea of utilizing a joint coach, which is usually a family member to help them out psychologically and to be with them for support during the process of going through the joint recovery and the therapy. We also take a multidisciplinary approach where there are multiple critical members of the team, including physical therapists, nurses, the medical personnel, of course the orthopedic surgeon, case management for discharge planning, and through this we've been able to adopt clinical pathways that help facilitate an improved and more systematic delivery of health care to the total joint patients. We follow accepted best practices and clinical pathways that have been worked out to try to optimize the patient's management, ease their comfort during the hospital stay, and reduce the risk of complications such as infections or blood clots or blood transfusions. Another good reason to consider our program is that we are accredited through the Joint Commission. This is a process in which we submit our outcomes and our processes to a review board. They actually do multiple interviews and then an on-site survey having reviewed our data, which include outcomes and complications and customer satisfaction. And then if all that goes well, you are accredited. We were the first hospital in East Tennessee to achieve Joint Commission accreditation for total joints. And this is an ongoing process. It has to actually be redone each year and requires ongoing restudy of your total joint program. Lastly, UT Medical Center is an academic medical center, and as a result, we're a teaching hospital and a tertiary hospital, and so we benefit from having the entire pool of subspecialty services available should anything be necessary during a patient's hospital stay for their total joint replacement.
We hope you'll join us soon for another medical moment. Visit utmedicalcenter.org or call the Healthcare Coordination Office at 865-305-6970 to learn about services available at the University of Tennessee Medical Center.